Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. Well, masks are much in the news, but not necessarily for good reasons. A federal court judge in Florida struck down the Biden administration's mask mandate. Now, that mandate was going to run out anyway within a couple weeks. But when the court struck it down, it basically said the Centers for Disease Control just didn't have the authority to enforce a mask mandate in public places like airports and train stations, on airlines, and other places. I think that decision was wrong, very wrong. One could say all of us are getting tired of COVID. It's absolutely clear that there's kind of COVID exhaustion. In talking with your patients, I'm sure many are saying they don't want to wear a mask, they want to go out, they want to go back to normal. I'm not sure the virus agrees yet. The virus is still around and highly contagious. It doesn't seem that the new strains that are around are severe, but there are still many people out there who are immune compromised. And it's very important that they mask, that they minimize contact with people who might be infected. And the mask mandate partly was a way to protect them, the millions of people with immunodeficiencies who had treatments that knocked out their immune system or weakened it. So we were asking the country to do something to help the vulnerable. The country basically kept filing lawsuits in court. Many people just dislike masks and invoke liberty. And they finally found a judge who said, you're right, I don't think the government has the authority. Well, a couple of points about mask mandates. The data on masks are pretty clear that they work. They're not wonderful. The better the mask, the better the protection. A lot of people wear cloth masks. They're not very good. When you get up to the N95s and better, then you get a lot of protection out of masks. And we know that because that's why they're so omnipresent in hospitals and surgery and many procedure areas. We know that masks protect the doctors, the nurses, and the staff, and protect patients from getting infections. So I don't even think it's worth arguing about the data on the value of masking. It's certainly worth arguing about what are the masks that people should be wearing, and do they wear them properly? I see plenty of people wearing them over their mouths and not putting them over their noses, or having them loose as they cover their faces. There have been a lot of problems with good compliance, but put that all to the side. The real fact is that mask mandates are over. We're not going to see them endure. This court decision has basically brought an end to the willingness of, I think, the private sector or anybody else to keep mask mandates in place. I think they're going to just retreat back to where they started, which was hospitals, hopefully nursing homes, where there are highly vulnerable people. And there are many reasons to want a mask, not only for COVID, but flu and other infectious diseases. I think the rest of society has had it. Well, if that's true, then a couple of things need to be made clear. Biden and his administration should challenge the court opinion, not because they want to extend mask mandates. I think the public is just done with those, but to establish the principle that they have the authority. What if we get a nastier strain of COVID that appears that not only is contagious, but is more virulent? We want to have the authority for the federal government to say, when you're going interstate, by travel, by train, whatever it is, that you can be ordered to wear a mask. That tool should not be out of the toolbox, no matter what this judge said. And I also think it's important that we start to shift our strategy for going away from masks. Then we should be going to test and treat. That's the situation where we make testing widely available and we use antiviral medicines to try and wipe out the virus if you're infected. You need to get that test and the medicine into the patient within 5 days of a positive test. It's clear that the United States is not set up to do this. We don't have the medicine out readily available. It isn't clear who's paying for it. It isn't even really clear that we have the tests available to make sure that people test frequently and make sure that they get to a doctor or get to a pharmacist if that's how we're going to distribute the antiviral drugs. So if masks are going away, test and treat needs to be empowered. That's something that ought to be discussed with patients. It's something that organized medicine should be pushing both state and federal government agencies to do. We don't want to disarm ourselves when we have another tool ready to go that really would help those who do get infected. So at the end of the day, masks served a purpose. We sort of ran out of gas in our willingness to help our neighbors, protect one another. I think sadly we got more selfishness coming to the fore, and, if you will, court shopping to find someone who would say the mask mandate is over. That can't be right. We don't want to face pandemics of the future without a strong CDC authority. And we certainly don't want to face the rest of this year without a strong test and treat policy if infections are going to become more prevalent or new variants might appear. I'm Art Caplan at the Division of Medical Ethics at the NYU Grossman School of Medicine. Thank you for watching.